Welcome to Hegde's Implant Care, reliable and predictable implant solutions for all. Today's case, I'm going to show you a case where a patient who has lost one teeth in the front and he wants a replacement with the implant and the teeth in the same day. So how are we going to go about it? You can see here in the cast, there's one particular tooth missing here, this one. So before you start with the case, there are some basic assessments to be done, which means that I have to assess whether the patient has got good quality bone, whether the bone foundation is good, whether the soft tissue foundation is good, whether I can get a good emergence profile. When I say good emergence profile, what I mean is when I place the implant and the teeth should look like it is coming from the tissues or from the gums. It should look like a natural teeth. How the adjacent teeth is, the next tooth is, the same way this particular teeth has to be, it has to look like that. So how do you go about it? First, I make the cast. Before placing the implant, there is some basic homework to be done. So what is the homework? First, I need to make a cast. You can see the cast here. I have to place the teeth on that, and with the teeth there, I have to assess whether for that particular position, I can see that I can place the implant in the right place. So before that, I have done the X-ray. You can see here the X-ray, how it looks. The tooth has been removed and it has been about 3 to 4 months. Until now the patient has something removable and now he wants a fixed one. So I have assessed the X-ray, I have done my wax up. Now I am going to start the case. I am going to show you in detail how we open up the gums, place the implant, place the artificial teeth and fix it in the same day. The entire procedure probably should take about 30 to 45 minutes. Now we can move on to the surgical area where I am going to show you the implant placement as well as placing the artificial teeth. The basic necessary preparations have been done. The instruments autoclaved and kept, and the patient is prepared. Okay, so now we are going to start with the implant surgery. You can take a look at the X-ray. I'm going to show you here now. These are the two adjacent teeth that are there. In between there is a space. This is where I'm going to place the X-ray. You can see in the patient's mouth. You can see here this particular tooth is missing, the central incisor. And before placing the implant, we have to assess the gingival biotype, the thickness of the tissues, whether it's healthy enough to take up the implants. Next thing we have to see is the implant position, the tooth position. You can see here this particular tooth is slightly positioned outside. The distal end is slightly outside. So we have to take care of that. When you give the final process, we have to do something similar so that it matches. The next important thing is the bone foundation, which I have already assessed. The bone foundation looks just enough, but we have a small problem here. The lateral incisor root is tipped towards the central. So we have to take care that when we place the implant, we do not impinge on the tooth. That is one thing I have to take care. So we have assessed the bone condition, we have assessed the soft tissue condition, we assessed the tooth position. Now I am going to start with the implant placement. We start with the mid-crestal incision. Incision always has to be very firm and it has to hit the bone. Once you are done with the mid-crestal incision, I have to give a clavicular incision on the next tooth. Now you can see here the flap has been reflected. Now I am going to place the first drill, my pilot drill. So before I do that, I have to, this is a surgical splint that I have created. Now this gives me an outline, the buccolingual placement as well as the mesodistal angulation. So with this splint I am going to assess where I am going to place it. Okay, this is going to give me the basic assessment. First drill I am going to place, it has to be about 2 to 3 mm from the inside, from the buccal line. I can show you in the picture that the buccal line, from the buccal surface of the teeth, my implant should be 2 to 3 mm inside. So this is the first drill based on the assessment I am going to place. See the first X-ray, the guide pin perfectly placed. Though the lateral is tilted, we have managed to get a good position. Now I am going to the second drill. See here, I am sequentially enlarging the osteotomy. I am widening the osteotomy. This is the next drill. This is my final drill. This is the countersink I am going to place. You can see now the osteotomy is ready. Now I am going to place the dental implant in the site. So you can see the implant being driven inside. Then yes, now I have kept a 30 Newton torque. Now I am going to increase it. You can see there that is 30 Newtons. So I am going to increase it to about 45. If I get about 40 to 45 Newtons, I can load it immediately. So you can see there 40 Newtons. Yes. Okay. So I have got about 40 Newtons torque. Now I am going to increase it slightly. Finishing my manually finishing it. Another 2 threads. Another 2 threads to go. I think we have achieved about 45 Newton torque, which is ideal for immediate placement, immediate loading. Yeah, you can see on the X-ray, it is well placed between the central and the lateral. We have placed a 3.6 into 12 mm implant. Though the lateral is tilted, we have just managed to avoid the lateral, and the placement is fine. I have got a 45 Newton torque, which means I can load it immediately and give the teeth on the same day. This is the artificial teeth that I am going to place today. Now I have already told you that we have got a torque of about 45 Newtons, which means immediate loading can be done. So this is the teeth that has been selected. We have to use a temporary abutment. Okay. Place the artificial teeth. So you can see here this teeth is a little too long. Kachi, bite. Yes, you can see it's hitting the lower teeth, and also it is too long. So probably I will have to bite. Probably I have to trim it a little bit. So this is the marking I have done here for the trimming. I have trimmed the abutment here to the required size. I am going to place the temporary abutment now. And now I am going to place the I am using a pro temp here. So as to fix the temporary teeth for the teeth to the abutment. So I am going to flow some material on this abutment. Yes, I am completely covering it, and then I have to place some material on the artificial teeth that I plan to give. Okay, once I am done with it, I place it to my desired place here. So this is how it's going to be. See here now the temporary crown, the immediate crown is fabricated. Now we have to check the contacts, whether his biting is all right and whether it interferes in the bite. So I have my articulating paper holder here. So bite, yes, just open, bite, yes, inside, yes, right and left, yes, front and back, front, yes, back, yes, okay, open, yes. So these are the eccentric movements that I am checking, whether all the movements has interference. So we will see the markings inside. Yes, I do see some marking. Now I am going to correct it. So all the eccentric contacts have to be removed, because this is a case of immediate loading, especially absolutely no contacts. So no interference, sorry, absolutely no interference from any side. Bite, open, bite, just go on tapping, yes, yes. Now front and back, back, front, back, left and right, yes, open, yes. Very minimal contacts I can see, which I am going to remove. Here you can see here that all the contacts have been removed here. So absolutely no force on the implant. Now before that, I am just going to polish this crown a little bit. I am going to give the final touches and then I am going to cement the crown. Starting with the suturing now. So I have placed a gingival former temporarily, because after placement of the crown it becomes a little difficult to suture. So place the gingival former and I am suturing. Yes, so I can start the suturing now here. So you can see the tooth is ready. Okay, we have checked all the contacts and it's finally finished. I am going to fix the crown, screw retained crown here. You can see on the mouth it's taken up its place right there. Okay, so now we just have to fix it on inside. So we have the implant screwed now inside. So next thing I'm going to do is I'm going to check the torque, how much of torque you need to give. We have achieved the final torque, how much is required now here. Yes. Yeah, you can see here now we have finished with the procedure. The final crown has been placed and all the contacts have been checked, centric and eccentric contacts have been checked, and the tooth matches with the adjacent teeth. We've been able to get that the slight tilt that was there. We've been able to achieve the same thing. So this is the final occlusion. As you have seen now, we have finished with the case. We started with the basic treatment planning. We have done the assessment of the bone, and also basically it's a lot of prosthetic job. So I have started with the finished teeth arrangement in hand. I have done the teeth arrangement. Based on that, I have made the surgical stent, and using the surgical stent, we have placed the implant. You can see in the X-ray that this is the final X-ray where you can see the implant with the abutment in place. Of course, the crown cannot be seen in the X-ray. So the entire procedure has taken me about 45 minutes. So now it would vary from case to case. Sometimes if the bone is not good, we might have to do some expansion of the bone and some grafting and whatever. So every case is different, but this is how we have gone about the case. And the patient has already left home, and he can get back to work. So this is a common question I come across, whether I can get back to work in the same day. So I think now he is quite comfortable now, and he can be back to work in maybe probably in an hour or two. Thank you for your patient hearing.